Saaghe Fogwe podcast. Elevate your life, empowering insights for growth, success, and fulfillment.
All right. Hello, everybody, and welcome to the Saaghe Fogwe podcast. I am super excited today. It's one special show today. And the reason it's special is because we're talking about something that our communities usually don't talk about so much. Not because we don't want to, it's because we don't know how to talk about, about how medications, how our genes affect the medications that we take. So we're talking about pharmacogenomics today. It's a new word that I'm learning, and I'm gonna be tongue-tied with it a little bit today, but I brought an expert to talk about it today. And the reason we need to talk about this is because there are times as medical professionals, we tend to put everybody in one box, and we feel like everybody can manage medication the same, everybody can react to medication the same, everybody's supposed to have the same effects on medication, and we judge some people. I mean, nurses, hey, we're all guilty, where we call that person a pain med seeker, or this person just likes medication, but we don't know what's really going on in their body. And before I go any further, I want to shout out to all nurse practitioners. I don't have a nurse practitioner on today, but a pharmacist. But all nurse practitioners, is Nurse Practitioner Week. So I thank you all for what you do. I thank everybody for your services, and and what you do every day to make sure our patients are safe, our patients are doing well, our patients are getting the help that they need, getting diagnosed with what they need, and getting the treatment that they need, and just having the heart of a nurse, because nurse practitioners will always have the heart of a nurse. So I want to shout out to you guys for everything you do. It's a special week. So friends, family, co-workers, make sure you love on your nurse practitioners this week. And in respect and honor of Nurse Practitioner Week, I chose this topic so that we could talk about medication. And so I'm not going to go too further into it, but I want to bring this special person on. She is she's a wife, she's a mother, she's a sister, she's an aunt to some people. She is the next door neighbor that you know. She has this contagious smile when you see her, no matter how mad you were earlier or how upset you were, her smile radiates, and it just gets you jumping out of your chair. So I am very honored to have her on today. She's no other person than Dr. Lusia Fomuso.
Thank you. Wow.
Welcome.
Thank you so much. What an introduction. Oh my goodness. Thank you so much. And I want to celebrate this practitioner week with you. That's super exciting. And I'm glad that you chose me to come have a session with you during this beautiful week for you guys.
Yeah, very
Right.
special.
Great.
I want us to share I know you have people waiting for the link. Let's share the link before you even start, before we get into anything. So I'm going to share the link with you.
Okay.
Guys, if you're joining right now, feel free to share, invite others, because today this topic will bless a lot of people. So I'm sending it your way, and then we'll do a couple of shares here, and we should go right into it.
All right.
Yeah, okay. There you go. I sent it your way.
Okay. I just received it. Let me put it
Okay. All right, guys.
in groups
Get
here.
a book and pen and get some nuggets today. Get some golden nuggets today about medication.
Absolutely. All right. Great. Okay.
All right.
I've shared
Couple.
with a few of my groups, so we're good
Okay.
to go.
Okay. A couple. Just give me. I'll do a couple shares here. I know there were some people who threatened me earlier, like, do not talk too long. Make sure we get the link before you keep going into it. I'm like, okay, I hear you.
Oh, I'm excited.
Yeah, yeah, it's a good topic. I'm glad we chose this. We're going to bless a lot of people today with this.
Absolutely. Yes.
All right. Anybody who doesn't get the link, well, subscribe. So if
Yeah.
you're not subscribed yet, make sure you click the notification button too, so that when we go live with our shows, you know right away. Then you should be the one sharing. So we're talking about pharmacogenomics today. What is pharmacogenomics? It's how our genes affect how medication works in our bodies. But before we go into the topic, Lucia, or Dr. Lucia, I cannot, she's my little sister, so I always jump to Lucia without and drop the doctor. She worked hard for that title, so I'm not going to take it away from her.
Thank
So,
you.
Dr. Lucia, tell our audience, our viewers, who you are. Just introduce yourself to the world. Let people, I kind of introduce you in a, airplane view, but
Yeah.
let's go a little bit deeper. Who is Lucia? Who are you? Tell us who you are so that we
Yeah.
know who we're visiting with today.
Absolutely. And you rightly said it. I start out by saying my most important title is mom. But I'm also a scientist and someone who's very, very excited about how our bodies break down medication. And so my background in pharmacy, I went to pharmacy school, graduated, worked the usual retail, did some hospital, and then I switched into consulting and just developed an interest as to why is it that one person reacts to a medicine one way and then another person doesn't. And so I started diving into this, which opened up an opportunity for me to do my TED Talk, and that has opened up even more opportunities. But I say I am a champion for this topic because we always think everything is cookie cutter, but that's not true. Each person's genes are so different, and so the way we'll react to things are going to be different. So I'm excited for this topic, and I would try my best to use my background and simplify it as much as possible so we're
Mhm.
not losing a lot of people in the audience.
Awesome. That's awesome. So in a nutshell, that's who Lucia is, right? And we'll get to know more about her as we go into the show. Tell us what motivates you, what keeps you grounded, what guides you, what are your principles, what are your values, what are your vision. I know we'll go into your vision, as we talk more, but just give us some
Yeah.
understanding of what grounds you.
Yes, kind of my why, I think you're asking me. So
Yes.
I have several whys, but I know for sure the one that's biggest to me is my family. There's a lot that we do daily, and we don't even think about why we're doing it, right? But for me, I know for sure it's my family. That is because from the time I was a child, my family put me in positions to have good examples, putting me through a boarding school, great education. I come from a family of educators, and so I had no choice but to copy their example, and that always grounds me. And that's education from different things too, right? Education from
Mhm.
life experiences, and also going to school. So my family has definitely grounded me throughout all of this, and it's been a journey, because when I
Mhm.
was younger, I always thought about going out and go somewhere far away and do things by myself. But the older I get, those values that were instilled in me by my family have grounded me, and they've made me realize how important it is to have family around, how important it is to have those values that keep you rooted, and it
Mhm.
affects every other aspect of your life. Absolutely.
Yeah. That's awesome. Yeah, and our values are important, and I ask that because, of course, this show is all about empowerment. This show is about uplifting people, positivity, and I always reiterate it every show in one way or another. We're not here to bash people. We're not here to put anybody down. We're not here to drag anybody down, but to uplift people. So every time the show comes on, every time we go through a show, we talk to anybody, we're making sure that we're making someone better than they were the minute they joined, or they clicked on the video to watch it, even if it's later, years later. We want to add some value. We want to add value to people. So how did you end up in the pharmacy school? I want to know
if it had always been, because your journey is, I don't know if it's the same as mine, but mine kind of, I circled and then ended up where I am. But some people just know that, okay, I want to be a scientist. I want to be a pharmacist right off the bat. How did you end up going to pharmacy school?
I always knew I wanted to be in medicine in general, but to say I knew for sure, then I would be lying. So in earlier on, I started working at CVS Pharmacy as a pharmacy technician at 19. So I kind of already knew that that was kind of what I was interested in. But I explored a little bit. So I shadowed a physician assistant, I shadowed some nurse practitioners. I always stayed away from going to medical school. For some reason, I was just like, in my mind, I want to be a step back. I can give you the knowledge, but you be on the other side and I'll be over here kind of thing. But one thing that really solidified in my mind was one of my cousins went to play soccer, and he had a kick to his head and he had some internal bleeding. And when he went for surgery, his dose for anesthesia was miscalculated. And I remember when we were told he passed away, that just hit me so hard. And one thing I took from that was that healthcare professionals are also human, right? They can make mistakes. But it made me so interested into looking at a pharmacy and just figuring out, okay, how does it work? How is it that a mistake like this could happen? And how is it that we could have done this mistake in this process at all? What are the blocks, the roadblocks, or maybe the checkpoints that we missed? And it definitely made me sure that what I wanted to do was go into pharmacy. I can almost remember that moment so clearly when I realized, okay, pharmacy it is. That's where I want to go. Yeah.
So that light bulb went off right then. Yeah.
Yes.
And did you guys hear her say she started at 19? I thought you were like 20, right? Doesn't she still look 19? She still looks 19.
So sweet of you.
Talking about when I was 19, back in the day, in my day, you know.
I mean, that's over 20 years ago now. How about that?
You will always be that baby sister, okay?
Yes.
All right. So let's talk about pharmacogenomics. So break it down for us, because that's a new term. I was making it a new word. I did the flyer like 5 times. She was like, not pharmacogenetics, pharmacogenomics. So break down that term for us to a lay person, somebody who's not medical, someone who, just break it down, because we have viewers from all backgrounds, so we don't want anybody getting lost. Just break it down for us. What does that term mean?
Absolutely. I love to simplify it as much as possible. So pharmacogenomics, and you could also say pharmacogenetics, but the actual term is pharmacogenomics. And that's kind of why I wanted us to make sure to get it right. But as the name states, pharmacogenomics, so pharmacy or medicine, and then your genes. So we for years have just thought that if a medicine works for one person, it's going to work for everybody. But sadly, that's not true. And that's because your genes, each person's genes are so specific. So even your mom and your dad that had 5 kids or 10 kids, each of those kids have different variations in their genes. So you might have a sister who will react one way, or brother who's going to react one way to medicine, and you react a completely different way. And so this is a new concept that we're talking about, right? We've been talking about precision medicine. That could mean different things. That could mean maybe looking at targets to make medications. But for me, it means, how are we personalizing this so that I know when I'm taking a medication, it should work for me because my genes will allow my body to metabolize this medicine. So that's a kind of simple way to put it. But pharmacogenomics is really analyzing how you as a person, your specific genetic buildup, how it's going to cause your response to differ from one person to the other. And does that mean your dosing needs to be different? Does that mean you should not take this medication? Does that mean that this medication would be toxic to you, but not toxic to another person? So there's a lot of nuances, and I'm looking forward to us diving into it some more, just so we can have some context and for people to understand it a little bit more. Yes.
Yeah, it's really interesting because yesterday I had a patient and I told her I was going to talk about her. Obviously, I'm not going to reveal any HIPAA information here, names and all that.
Yeah.
But I'm like we've seen from a previous show, I'm in hormone replacement right now. I'm just now going over to the female side. I've been with the men and I'm training on the female side with hormone replacement. And I had a patient who is on a high dose of testosterone. She's a female. She has a high dose, but it's not touching her. So she's not, I mean, the symptoms that we normally treat with hormone replacement is your energy level, your sex drive, your mood, your sleep. None of this is working for her, but she's on a very high dose compared to other women. And I brought it up. I told her I was going to be on doing my podcast today, talking about this. She was like, I wish I could be on, but of course I can't bring a patient on, get in trouble. So so we talked about it, and and just the fact that we were going to talk about this today, it kind of a light bulb went off too, because I was like, for years we've treated patients all the same. We always assume that everybody's going to react the same, and nurses, again, we're guilty when we do that report where you stand and you're giving a report on the patient, day shift handing over to night shift, and you're like, yeah, patient in room so and so, they're a pain med seeker, they're a frequent flyer, da 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 da. We have all these little things that we've already prejudged the patient.
Yes.
Because of the way they're reacting. I mean, granted, we do have patients like that who are seeking meds, who want who the clock, the ones who keep the clock and their pain meds every 4 hours, every 2 hours, and you have those patients. But how can we break down this barrier? Because this is something that we really need to, I mean, how can we really get our community to be educated on this, on knowing that not everybody will react the same way? Because it's something that's inbuilt in us now, but if we're educated on it, we're going to react differently. So how do you suggest that we can start breaking down this barrier?
I do think we have to be advocates for ourselves and for our family members. So you know your body better than anybody else. And so being vocal and talking about it is so important. And so listening to a podcast like this, that's going to open your mind to this topic. The next time you go in to see your doctor, I think your conversation will probably go a little bit differently, because now you have some background and you know you need to advocate for yourself. So let me touch on a few things you said. So for example, the pain patients you talk about, yes, there are some pain seekers out there. However, sometimes they're scheduling those doses and taking them at those times, not only because they're hooked on it, but because it probably is not working. And so that goes back to pharmacogenomics, right? So most pain medications, I know a lot of people know what tramadol is, but most pain medications, your body needs to activate them before it starts working in the body. So if your gene that activates that pain medication has a variant, so it can have a variant in one way or the other, it can actually cause your body to activate it very fast, which means you're going to clear that pain medication from your body faster. And so 2 hours later, you're already in pain because your body just clears it so fast. So you're not really a drug seeker, you're really telling the truth. And the solution can just be to give you a medication that is not going to be activated by that particular gene. And so it's going to work the way it's supposed to work. It can also do the opposite way. It can probably not activate at all. Right? And so you're not going to get pain relief because that drug is never converted to the active form. Or maybe it's converted too slowly to the active form. And so you keep complaining, oh my God, it takes so long for this medication to work. Or now you get it working for such a long time, you're groggy for days. Hence why some people will say, I take a pain med and I am out of it for days. And you're like, wait a minute, I took that, it was fine. There was nothing wrong. It could just be that your gene has a variant and it's causing you to react differently to that pain medication. We see this in so many different areas. Cardiovascular disease. I'll touch on just one thing because our cultures and a lot of us Black people have this variant and we don't even know. So blood thinners, there is a specific gene that has to get them metabolized so it will work. And a lot of Black people have a variant to that gene. And so there's a blood thinner called warfarin. Many Black people cannot even take that. So imagine if you had a stroke. So as a nurse how warfarin is given out like candy for any kind of heart incident. And a lot of times now you're taking it thinking, okay, I'm good. We're thinning my blood. I'm not going to have a clot. But maybe it's not even working because your body is not metabolizing it. And so people get second strokes, third strokes, or heart attack or things like that because you're taking a medicine that your body is not able to metabolize so it can work the way it's supposed to work. But I'll stop there so you can ask me something.
No, just, I mean, I really, it's interesting because we have different classes of medication. We have like you said, the blood thinners, we have blood pressure medicines. That's, one of them. So I still go further to just give us examples from different classes, just to kind of give us, how we can think about this better, because we get to a point where we become robots as professionals, which, it's easy to get complacent, to get to the point where you're just comfortable with your job. You just, as a nurse, as a medication tech, anybody who hands out medication to a patient, you get to that point where you're just waiting for the order from the doctor to hand out the medication to your patients. And because of the settings we work in, think about the nursing home. I remember as a manager, I had to take over the med tech job one time. My feet were this big by the time I was done passing out meds because it was so many patients. You had to hand out the medication and you're not even thinking. You just want to check a box that you've handed out this medication. So we don't have a lot of room to think. But if we start thinking about these things even better, like those who are spending the most time with the patients, you will know that patient A from patient B, I give them the same medication, but patient A is reacting this way, patient B. So you breaking it down and actually going through the different classes as detailed as you want to go. Just break down some of these classes of medications so that we can start thinking about it and you highlight it for us a little bit more.
Absolutely. So like the first thing that pops up in my mind when you even ask that is statins. I think half of our population is on statins.
Cholesterol meds. Please break it down further.
Cholesterol, yes.
Everybody knows what a statin is.
If you take a medication that ends with the word statin, so simvastatin, rosuvastatin, atorvastatin, if you take any of those, that's used to kind of get your cholesterol levels to where they need to be. I'm going to try to really use plain terms so it makes sense. And so most of the time you're taking that at night. Some people wake up in the morning and they have muscle cramps and they say, well, my sister said this works for her. How come this is not working for me? Again, that could be just due to your genes, the way that medication is transported in the body using a certain transport. And so if your transport protein has a variant, you are not breaking it down the way you're supposed to. And so it might mean switching you to a different version of that medication completely. I hope the underlying message here is if you're feeling like I am not getting relief from my medicine, speak up. Don't sit quiet and say, well, this is the medicine that they give for
the doctor gave me.
And everybody uses it. So of course, maybe something is just wrong with me. No, nothing's wrong with you. Your genes might just be different. I'll give another example. Let's talk about oncology. When most people get on chemotherapy, which is medications that you take when you have cancer, you lose your hair, you end up with a ton of infections in the hospital. And sometimes it doesn't work. And a lot of times we just stick with the fact that there was this journal article that had a clinical trial in 1,000 people and it worked. Well, guess what? Those 1,000 people, did it account for Black people? How many percent Black people were there? Was it 1% or 0.5%? So did they check to see how we react to it? How many Asians were in that trial? And so it might have been good for a subset of people, but a whole other subset will be completely not touched by that medicine. So why would you want to go through losing your hair, having infections if it's not even going to work? That's putting your body through unnecessary adverse reactions and things like that. Another blood thinner that's popping to my mind is Plavix. Plavix is a blood thinner that a lot of people use as well after an event. And Pacific Islanders, Asians, don't metabolize that at all. Their body does not break it down. So if they're taking it, it's not working the way it's supposed to. Let's talk about psych. So I know our community shies away from
From
mental
psych.
health.
Yeah.
But this is such an important topic to talk about, because you can't be a caretaker for your family or a provider or support system for your family if you are not okay. You need to take care of yourself first. And so I hope everybody can listen to this and really take it seriously. A lot of times when you complain about, I'm down, I'm not feeling good, and they say, well, we think you're having some depression, let's give you some medicine that will help you. The first thing that most clinicians will write is Prozac, because it's something we've known for years. Or maybe Zoloft, or maybe yours is called Sertraline, or something else. But guess what? Your body might not be breaking that down. Those drugs are usually first-line therapy, but it doesn't mean everybody is going to break it down the same way. And interestingly, you can attest to this. Most of the time, someone has to take that for at least 6 weeks to 8 weeks to kind of get a sense of, is it working? And sometimes if it doesn't work, your doctor will say, well, let's just increase your dose to see if that's what the problem is. Never really thinking, wait a minute, maybe this person is not even metabolizing this. And so a lot of suicides, a lot of prolonged depression, a lot of things can be avoided if right from the beginning you're testing and checking all of that and going, wait a minute, this person might not be a good fit for this particular psych med. Let's put them on this because their body is gonna take this and it will work the way it's supposed to.
Before you go on to the next class, just jumping in on that particular one, because we're trained as prescribers to start slow, go slow, start low, go slow, and then maximize the same class of medication before you move to another class. So we're programmed. Like I said, we become robots sometimes, right? We are programmed now to know that I'm going to start Lucia on this, and then I'm going to start at 5 milligrams, then I'll go to 10, 20, 40, maximize it. If the highest dose is 80, I have to get to 80 before I try to move to. But now with this knowledge, how can we incorporate this to change that, break down that, that mindset? Because we've been trained one way, but there's this important feature that we don't get taught this in school. So this is something that probably needs to get into the curriculum somehow. But how do you think we can break that barrier?
I think as clinicians, it's what you're doing here, just educating yourself on it. Because if you think about it, if you're having to go to the highest dose of a specific medication, it should really make you pause and go, how long has this person been on it? If they're taking it for 5-10 years and needing to go up, that's a whole different story. But you start someone on something and they come back and say, I still don't feel good. I feel like it's not working. That should be a red flag for you right away. We're not saying that some cases are not needing higher doses. They are. But you have to use every tool in your toolbox, right? You're opening your toolbox and saying, okay, wait a minute, this doesn't add up. The normal thing I see in this situation is this, and this person is presenting a little bit differently. So that's where you take a step back and say, maybe something else is going on. Let me start over and look at this and make sure I've dotted all my I's and crossed all my T's. So I would advise clinicians, prescribers, to really take a step back and look at their patients again as a whole. And like you rightly said, healthcare professionals are busy. And so I call out to family members as well. Family members need to take a huge role in their family's health. If you're living with someone and they're on a medicine that's supposed to help them in one way, and they're constantly complaining about that same thing over and over, I want you to pause and say, hey, you know what? Maybe you should talk to the doctor about, could I be potentially not processing this like I'm supposed to? So let's all take it on, because yes, if you as the prescriber missed it, a family member or that patient could advocate for themselves and say, hey, something is not right here. Let's pause and look at it and see if maybe we're approaching this the wrong way.
Yeah, and it gets to that point where we're dismissive of family members too, when we have that a family member who calls a lot, who is in your face, because we have those who are strong personalities. I know those, again, back to the nursing home, those family members who hadn't come for 5 years and they come one time and they want to advocate for everything. So you get annoyed with those family members and you kind of dismissive of them.
Yeah.
But we have to now as professionals get into that mindset of, we need to just take a step back and pay a little bit of attention to either the patient or what they're saying to you, because they're not always wrong. They might know a little bit more than than what you think they do. Because some of them, of course, they go on Google, Dr. Google, and Google, and then come back and tell you that, hey, Google said this, or someone, I looked it up on the internet, and not always right. It's somebody's opinion, but then some, they might have some, information that's true. So my question to you is, you're talking about genes. What happens to someone who's adopted? If you're adopted and you don't know your family, the history. So how can we get around that with somebody who, who doesn't know their bloodline, doesn't know the history? How can we get to the point where we can help that person now, with their...
I actually love this question because it's going to clarify a lot of myths. So every person really should test themselves. So a pharmacogenomics test is really just a kit that comes to you. You swab your cheek. It's kind of like 23andMe.
Oh, really?
And you send it back and your results come out and it tells you clearly. You can use it as your own dictionary for the rest of your life because your genes don't change. The science of reading genes might change, and so maybe 10 years, 20 years down the line, you might want to do it again, but your genes will never change. So I think relying so much on family history is a myth. So yes, there are aspects of our genes that are passed down, right? But in this specific scenario, you need to do your own gene test. So don't say my sister did one or my brother did one and our family is okay with this class. No, each person is so different. So you want to do your gene test for yourself, your pharmacogenomics test for yourself. And I'll throw in one more thing here, because sometimes it's not even your gene that is the problem. Here's where it gets complicated. You're on one medication, it's working well, it's doing very okay. So it's activating the way it's supposed to. However, it also moderately blocks receptors for another medicine. And so now when they give you this new medicine, you're thinking, well, my report did not say anything about me being, a poor metabolizer of this new medicine, so I should be okay. This is where your clinicians come in, because now they can look and say, oh, wait a minute, you're on this antidepressant that's literally blocking the receptors you need for this pain medication. And so now that's going to change what choice is given for you. So I just want to throw in that part about, yes, there are some times where your genes are okay, but you're taking something that's going and blocking, and so it can also affect that. So it's kind of like there are layers to peel. And so really educating yourself on it is so important as clinicians, and knowing that there's that aspect. It's not only like you inherited it from a family member, there's an aspect of your genes having a specific variant. So this is specific to you as a person.
That's very interesting. Yeah. So the kit, where can we get this kit? Is it Walgreens, CVS, Amazon? Where can we get a kit like that?
So right now, most insurances don't like to pay for it. So people struggle. Some insurances do. I know Medicare for sure does. So definitely talk to your doctor about it. There is a site called findyourpharmacist.com, findyourpharmacist.com with an S at the end. You see your state and you can select someone on that site who can guide you through the process of getting your pharmacogenomics test done. So if you ask your primary care doctor and they're like, I don't know, I've never heard about this, don't give up. Go to that site, find someone in your state who's able to order that for you.
Wow, interesting. So, whoa, this is a lot of information. I feel like I need to go back to school. I said I was done, that the kids are the ones who are going to be going to school, but I feel now like I have to go back, because I'm even guilty of prescribing. I know we have tools that will show interaction between medications and things like that, but it doesn't, it won't necessarily tell us in terms of genes.
Yes.
So is that something that's in the works that will come up at some point that's is there some evolve evolution that's going to come about that will change how, like where technology can come in and help us do, check medication quickly for interaction in terms of that?
Absolutely. In the US, it's movements are happening. Some states have been catching on, especially Medicaid. So Medicaid is catching on that. Why do I want to pay for this medicine if it's not even going to work for this person? And so now they're putting things in place, putting it in formularies, putting it in hospitals to start doing this. But it's taking a while. For me, what's hitting me so hard is our people back home in our home countries now, African countries in Cameroon, Nigeria, Kenya, all these places. How do they get access to this? So I'm calling on our scientists to say, let's partner together. Let's figure out a way. See, a COVID test kit was made in what? Literally months. Can we make a kit that our grandma in the village can swab and test and know immediately if they have a variant to their gene that's causing one of their meds not to work? So that's my call out to the scientists in the world. Reach out to me. I would love to have a conversation about this because I think in the US, yes, it's slowly moving, but they'll get there. But what about our African countries? I have a burden for that. I have a burden for how can we get these tools into the hands of our sisters back home, our cousins, our brothers, our moms, our kids who are going through different health struggles. Yeah.
Yeah, and think about how many people back in Africa who find out very late about a diagnosis, like a certain disease that they didn't even know they had. And then, let alone they're treating something that they don't even know with just getting pain meds from whoever. You hand them something that, they don't even know how it's processed. Then, that alone is already a barrier. And then you're even going deeper now, talking about genes and how they're processing medication. That's, another level. But again, let's, take this opportunity. If we're looking for something to use our brains, we have a lot of smart people in our community. We have a lot of scientists out there. So let's take this as a challenge, because when I've heard her talk about this in the past, it didn't really, I've listened to this topic, but I'm hearing new things now that I hadn't heard before. And as a professional, these are things that are important because we're on medication, whether we like it or not. We're getting older. Once you cross 30, you start with one medication. Before you know it, I have a pill box now like a grandma, but it's mostly supplements. It's mostly supplements and my statin, my cholesterol pill, but it's gonna grow, it keeps growing. You keep adding onto it. But even those supplements that I'm taking, I don't even know if I'm processing them, the way I should, if they're working, if they're doing what they need to do for me, because I've started having joint pain, knees are hurting. Now I can tell that I'm above 40.
And I'll tell you, there is something for that. It's called nutrigenomics. So they can check for you to tell you when you take your calcium tablet, are you actually metabolizing it? So there is something out there for that. Yeah.
Wow. How many pharmacists are into this topic like you? Because I want to know if this is like across the board. Are all pharmacists into the pharmacogenomics, or is it just your specialty? And if it is, are they teaching this in pharmacy school? Is this something that needs to maybe be taught in nurse practitioner school, med school, and like where people are actually taking this on as a topic?
So it's a very, I want to say, newer topic. It's not a new science. No, we've known about it for years, but like you said, it's not taught in schools. I've really just developed a love for it because the more I think about it, the more it makes sense. Like, why is this not a standard of care? And so I do agree. Every program should have a class, a course on pharmacogenomics, a deeper dive, because if we have our people who are prescribing this meds understanding this, it's a game changer. So this year I got to attend the National Pharmacists Association, and I talked to some deans of programs about this topic. And I said to them, do you have this in your curriculum? Is this part of what you teach your pharmacy students? And some said, well, we've taught about it. And some said, no, we don't teach that. And so I think this is a conversation that's going to be going on for years. we touch genomics a little bit in pharmacy school. They'll talk about CYP enzymes. Let's not get too scientific. We'll talk about drug metabolism, but we don't talk about how people's genes can have variants to those things we're talking about. And so I think that's an important piece to put in there, to say, okay, when we talk about this, let's add this other piece. But I'm definitely not going to stop talking about it, because it's super important. Every chance I get, I talk about it. I make sure everybody I connect with, I talk about it, because it's too important. It's too important of a message to not share, with people.
Yes, I agree. And nurse practitioners, since this is your week, I hope you're listening. We just had a Cameroonian nurse practitioner conference recently, so we should think about having this lady on next time to come talk about pharmacogenomics. So I'm already volunteering you.
Yes.
For the next conference, I think it might be in Maryland. So by then the baby will be here. We can fly. Blah blah blah.
Absolutely, count me in. I never get tired of. I'm sure you've seen me talking about this many times, but I don't get tired. It's too
and she's been on TED Talks before, 2 TED Talks. She's talked about this. Talk a little bit about those, how you came about to even be on those TED Talks, and you know, it's a big deal to be on a big stage like that, presenting this. It's a big deal. So talk a little bit about that and how you came about being on there.
Absolutely. And I honestly, I don't take these opportunities for granted, because I know people who have wanted to do a talk for years. They've applied several times and it doesn't get selected. So I'm really, really thankful for these opportunities. But my first one, I actually didn't apply for. Someone nominated me from where I was working at that time. And so TEDx reached out to me and they said, can you send us a video on medication safety? So I sent that in, and they said, yes, we want to hear about this. And so I was assigned a coach, a speaking coach. I went through my manuscript, built out my message, and got to present that. But once I entered into pharmacogenomics, so now I was like, oh my God, this is mind-blowing. I definitely want to do this. What helped me is because I had done one before. So I just contacted the TEDx, the organizers for my area, and I said, well, I have this topic. It's new, and it's a breakthrough topic. So I want to see if you would allow me to present this. And so they had me do a short video again, and I sent it to them, and they were like, you know what? We absolutely want you to do this. And so I got to build something shorter. I didn't want it to be overwhelming, because can you imagine a long talk on this topic? People are going to be
going to be glazed over right now. Some people are yawning right now.
So I kept it short, 5 minutes, just enough to spark interest. And it was so mind-blowing, both experiences, because people reached out to me afterwards. I got to get flown out to talk at maybe groups of doctors and stuff like that. And it's been a great opportunity to be able to use my TED Talk to leverage other talks, and it's been a great experience. Yes,
that's amazing. But how come you haven't started a book on this, or is there a book in the works? Because she's an author as well, guys. She's written 2 books. So talk about those books, and why don't we have a book yet on this topic? Because is it because we don't read anymore?
I actually do have a book on this topic coming up. I have some people proofreading it right now, trying to figure out how do we simplify it and make it where someone can just have little chunks of it and understand it. So it's working, it's coming.
Okay, I didn't even know that. So, okay, I'm glad I pulled it out.
Yes. So, but I do have 2 books. I wrote a children's book first, and that just stemmed from conversations with I have a 6-year-old. It stemmed from conversations with my son. And so I would try to tell him about, well, not only doctors are important, you have the grocery store worker. If the grocery store worker was not there, we would not have food to eat in the house. Or the electrician, and say, if they were not there working, guess what? We wouldn't have any power. You wouldn't be able to play your devices and watch TV. And so it just grew from that to, wait a minute, this is an interesting topic. And I'm sure parents would like to use this to teach their kids about everyday heroes. And so that started that project. Got to publish it in 2020. It's doing really well. I have
10 copies. I have 10 copies. I still have to hand some out. I bought about 10.
Oh my God. I got called recently to go on Spectrum TV to talk about the book, because the book is still making waves from from 2020. So I'm really excited about that.
Yeah.
And then I
Yeah, on the screen.
recently,
Yeah, before you continue, on the screen, that's, those are videos from your TED Talks, right?
yes, those
Yeah.
are. Oh, that's beautiful. Thank you. So I just wrote a second book which focuses on stress relief, and I tailored it to pregnancy. But this, what I talk about in the book, can help everybody. Like we mentioned before, mental health is everything. If you're not
Mhm.
okay, there's no way you can help anybody else. And so just focusing on relieving your stress and making sure your life is balanced, is where it needs to be. And that was so important for me to be able to share that with people.
Yeah. Yeah, especially right now, she's heavily pregnant. You can't see it on the screen. And that's why she's virtual right now. She got
Yes.
a pass not to be in studio today because I wasn't trying to deliver a baby today.
Yeah, you don't know what to do. That's the good
I
part,
don't
right?
know from the mother side, but actually catching the baby, knowing what, no, all of the, I don't do OB, okay? The OB NPs out there will know what to do. I'm
Oh
just going
boy.
to call 911. Yeah,
Yeah.
but she's, so when she's talking about stress relief, even in pregnancy, that's important. Yes, we're talking about all this medication stuff, but there's some things that don't always go to medication. It can be non-invasive. There are things that we can do without it. So talk a little bit more, go a little bit into the book just to give us a preview. For
Yes.
those
You
for
don't want
women,
to give it all
men.
away.
Yeah, don't give it all away. No, don't. Just give us
Yeah.
a teaser. A
A
teaser.
teaser, yeah.
Mhm.
So in the book, I just cover different things we can do on a daily basis to kind of bring your body back to a good rhythm. And it could just be maybe taking deep breaths. We overlook the importance of sitting still and just taking a good deep breath to get your blood flowing right, your oxygen going right. And that is so important. Do that several times a day and you notice your head is clearer. You just feel more relaxed. Or maybe going for a massage. A lot of times we're like, I can't schedule it, it's too expensive. Guess what? I think if you invest once and do it, you realize that, oh my God, I needed this. I needed the stress relief. I had knots everywhere. And sometimes even just taking a few minutes for yourself, go into your backyard, grab a cup of tea and just sit there and look at the trees and put everything out of your head. Just have that moment where it's for you. It's your
Mhm.
time. Don't worry about anything. If anybody comes knocking, you say, wait, I got to take this 20 minutes. That's my time. And
Mhm.
talking to someone. I know a lot of us are like, oh, I don't want to burden people. I don't want to stress someone. Or am I going to share this and it's going to end up on
Mhm.
CRTV? And so we worry
Mhm.
about sharing things with people, but find your trusted someone that you can say, hey, I'm struggling with something. Something is weighing on my mind. Am I thinking about this too much or am I stressing about it? And
Mhm.
bouncing things off of somebody. Sometimes you might not take their advice, and sometimes you might not even need their advice. You're just airing your mind.
Yes.
You're just getting it off your shoulders and realizing that yes, I don't need to carry the weight of the world on my shoulders. So those
Yeah.
are some things I talk about in the book. Is things we know that we forget about
Yes.
all the time.
Mhm. We need to be reminded. Yeah, and it's mental health is very important. Again, our communities, we're not very open to that. We're starting to be a little bit because we're getting more psych or mental health professionals
Yeah,
around us. So we're getting better with that. Self-care is important. We have to make sure we take care of ourselves. I have my once a week talk to someone apart from talking to everybody else.
right.
As everybody knows, I'm an open book. Talk,
Yeah,
joke, and then when I get off the phone, the relief, you feel a little bit more relieved. So
yeah,
it's very important for us to do that to relieve that stress.
yeah.
So before we round up here, I don't we don't want to make it too long a show and get people nodding off. But I have a couple more questions before we round up. But I just want to make sure that so you're the topic of pharmacogenomics. You're not only focused on Black people, right?
Correct.
You're focused on all because I have viewers from all over,
Everywhere. It's
everybody. So
everybody.
I just want to make sure that it's not just we're not focused on Africans, we're not focused on people who look like me and you.
Right.
We're focused on everybody, right? So just talk about
Everybody.
that a little bit. That way we can clear that up. to make sure.
Yes. So I love that you brought that up. This applies to every single person in the world, not only in one community. I gave some examples of Pacific Islanders and maybe Asians and talk about Black people, but in the white community as well, this is a big deal. Just the thought about the pain meds that I talked about. You can find that so many people have a variant to that gene in every single race. So this is a conversation that surpasses the color of our skin. It's a conversation about what's on the inside and how can we optimize how we take care of our body. So this goes to everyone, every
Everybody.
person. Absolutely.
Yeah. Yeah. I thought, we clear that up. That way, we know what audience, it's everybody. It's not just specific to anybody because, that can help just whoever. So how can the community help with this journey? How can we help with getting the word out, making sure that people know about this? We need to start. I think we need to start getting to that point where we're having some conversations like this that can make things better. Yes, we have intelligent conversations, but we want to add some things that will make some changes or things that problem solving. I think that's what I'm getting at, where the conversations are not just talking about the problem, but how can we solve the problem? So how can the community help?
I love that. So the first step, of course, is the education, knowing about it, right? Now you know about it. Don't just sit there and do nothing. Try your best to get a kit for your family and get yourself tested. Do that kit. You see how easy it is. And so you can advocate now for members of your family to get that done. Because once you, like I said, it's a one-time thing. It's not like every 2 weeks you have to test yourself. No. Once you do it one time, you have it. So even for kids, I've had maternity staff who have reached out and asked, is this some information we can put in our maternity packages? Because imagine testing your kid when they're born and making sure that throughout their life, you're never putting any toxic things in their body, things that are not going to work. So we need to all take this information and go and actually implement it. Please don't sit on it. If your insurance doesn't pay for it, think about it and figure out if it's something you can afford. And again, I'll throw this to my scientists out there. Let's figure out a way to make kits that are cost effective for people so we can get this tool in a lot of people's hands.
I'll be a silent partner. Silent partner. I'm already volunteering. A silent partner in the venture.
Yes, I love that. I love that. We need to do. We can't just hear and then sit on it. My role has been talking about it, but I am so open to putting my hands to things. If I have to go out into a community, go into a church to educate elderly people about this, I love doing things like that. And so let's carry the message forward and not just sit on it.
Okay, awesome. So I had 2 more questions, and then I think we can call it a day.
Okay.
So contact information, how can people reach out to you? How can people reach out to you? How can they get the book? I'm sure people want to get that hero book. I have 10 already. I'm hogging 10 of them. And then your other book, the stress relief book, I'm sure people want to reach out to that. So how can we reach out?
The easiest way is probably to go to my website, which is, you have it up. Awesome. It's
on the screen.
So drlusia.com. There's numbers there to reach me. My email is there. You can find out some more information about me. The links to my book are on the website as well as other things that I offer to people in our community. So go to my website. It has pretty much everything you will need to know or how to get access to the resources and everything we talk about. So
yeah, those are the 2 books. Yeah. Okay.
Yeah. Absolutely.
Awesome. Yeah, let's support a sister, help her out here, and proceeds are probably going to some, those proceeds will not end up in her bank
I have
account.
a nonprofit called Ask a Pharmacist Africa, actually. And so every year I do some educational materials. Sometimes, like now, because I'm pregnant, I think a lot about pregnant women. So having tools taken to maternities and masks and whatever, education on malaria. I'm constantly using my platform to extend knowledge to people.
Yeah,
motivation.
nurse practitioners, we're going to be reaching out to you. We need partners. So we'll partner with you on some of these things that, yeah, that you're doing. We'll
Yeah.
definitely want to reach out. But we do appreciate everything that you do, what you're doing in the community. You've blessed us today. This topic was very important to, I know that this is just a tip of the iceberg. We couldn't go into the beef
So,
of it. Otherwise people
yeah,
will start logging off and
probably like,
falling
wait a
asleep.
minute, what is that?
Just giving a preview. But thank you for what you do. Thank you for your passion on this topic, and the commitment to help people. Is there anything like a final word something I didn't ask that you were really burning to talk about and that we didn't touch on? Just final words to our viewers.
Well, thank you. I really just want to thank you for acknowledging that this is a huge topic and inviting me on to talk about it. It just makes me so excited to know that we're reaching even more people with this. And so I just want to tell anyone who's maybe having some more questions around this, please don't hesitate to reach out to me. I think we touched on a lot of things, so I don't want to pile on anymore. But please, if you want more information, reach out to me. I would love to get on a phone call, have a conversation with you, and maybe explain it a little bit more, guide you to resources in your state to get access to this information or even the testing. And I, on the final note, I really want to celebrate the nurse practitioners this week. It's wonderful to have key clinicians like yourself that can take messages like this and get it as high as possible. So I support you guys, and I'm excited to be here on your special week. So thank you again.
Thank you so much. And thank everyone who's watching, who's shared the video, anyone who has made sure that someone jumped on or will watch it later. We appreciate all of you. And as next week comes up, Thanksgiving, just, for those in the US, celebrate with your families. We'll have a show on Wednesday, obviously the day before Thanksgiving, but I want to thank all of you for coming on today and watching the show and for everything that you do in the community. And until next time, I want to thank all of you and stay blessed.
Thank you for having me.